Hi there, my name is Emma Milliken, and today I'm going to be talking about deep brain stimulation therapy of the subthalamic nucleus. And this is a surgical procedure where an electrode is inserted into the brain, and this is usually performed on patients that have been diagnosed with advanced Parkinson's disease. And the reason I am interested in this topic is because we have discussed Parkinson's disease throughout the semester, and this is a treatment process that has been shown to really improve the lives of those diagnosed. And the article that I read was a literature review. So the authors investigated their research question of how does deep brain stimulation therapy improve the lives of those diagnosed with Parkinson's disease by looking at different studies. And one study in particular looked at how the symptoms of Parkinson's disease are decreased after the surgical undergoing of deep brain stimulation therapy. And it was shown that out of 921 patients, there was a dramatic decrease in symptoms such as rigidity and tremors. Another study that they looked at showed that there were some common side effects of the procedure, such as depression, hardware malfunction, and implantation problems and infection. And with all the studies that they looked at, they overall concluded that deep brain stimulation therapy of the subthalamic nucleus can be risky, but the benefits can outweigh the negatives in a healthy patient who is ready to undergo surgery. And some of the strengths of the article that I read was that they pulled from many different sources, and they thoroughly described the surgical procedures and all aspects of deep brain therapy. However, they did not go very in depth on how speech is affected. It was briefly mentioned, and about 2 sentences of the 15-page article went into speech, and that is something that I would like them to further investigate. However, what they did say was that speech can be negatively affected by this procedure. Something that I would like to have more information on is it possible to make this procedure help speech, and is there a way that they can perform it without damaging the speech functions? Also, one more question that I have is it possible for them to make this treatment more affordable and more accessible in developing countries? Because that was one thing that the article mentioned has not been studied so much, and I agreed with them. I would like to know more about that.